Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello everyone, this is Dr. Sanjiv Sharma, working as a senior consultant neurology at Hospital, Ranchi.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, seizure is also considered as a convulsion, that is synonymous, and seizure is due to the excessive abnormal synchronous discharges in the brain, and that affect the brain, and it is also considered as a storm in the brain. So it's just like a electric spark which will happen in the brain and affect the patient, and it causes clinical manifestation either in the form of complex partial seizure or generalized seizure.
What is epilepsy?
If two seizure will occur 24-hour apart and it should be unprovoked, that is called epilepsy. All seizure is not considered as epilepsy. Like if a patient having diabetes mellitus and sugar became suddenly dropped down to 30, then the chances of seizure can be high. That is called hypoglycemic seizure. If the patient is alcoholic and he is taking excessive amount of alcohol, or after 2 days of withdrawal, patient can have seizure. It could be alcohol withdrawal seizure or alcohol intoxication related seizure. That is not considered as epilepsy.
What are the different types of seizures and do they affect people differently?
Uh, it's better to call epilepsy rather than seizure. Different type of epilepsy. The as per International League Against Epilepsy 2017, the epilepsy is classified into three types: the focal one, and generalized and unknown onset. So the focal one of two type, sometimes patient will have loss of awareness from the surrounding, or if the patient is fully conscious during the seizure. So if in both the condition seizure can be motor, it will start from one side, one side of the body, like arm affected, leg affected, and then it will spread to the other side. It can be tonic, it can be clonic, it can be myoclonic. So these type of the onset will occur from one side of the body. That is called focal seizure. And there are some type of focal seizure in which patient will not have motor symptoms, like behavioral arrest. Patient will have suddenly lost from the surrounding for a couple of minutes or 30 second, 1 minute. So in this condition, it is called as complex partial seizure. Whereas generalized epilepsy is of also two type. One is motor type, another one is non-motor. The in which the motor type, patient will have up rolling of eye, jerky movement of the limbs, all four limbs, and tongue bite could be present. This is called generalized epilepsy. It can be myoclonic, tonic-clonic, clonic, and there are generalized epilepsy in which patient will not have motor symptom like convulsion, movement will not occur. So example is absence epilepsy, which is very common in young children. So the teacher will assess. Sometimes patient will have like child will have uh, scholastic performance will decrease, sudden attention deficit will be there, the child will blink, and suddenly behavioral arrest will occur for 3 to 4 seconds, and patient will become normal. So absence epilepsy is very important.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Usually in young children, possibility of genetic epilepsy is high, especially neonate and before 5 years of age. Genetic epilepsy is very common. There are another type of epilepsy is called acquired epilepsy, which is most important and that can be preventable. Like if a patient having a stroke, that is called post-stroke epilepsy, we can prevent the stroke. We can regulate the BP and control the sugar to prevent the stroke risk. Second is trauma, which is very important. So wear seat belt, wearing helmet is very important to avoid head injury and post traumatic epilepsy. And third is the food habit, which is very important. Not take any uncooked food material like salad outside and cabbage. These are the common source of neurocystic psychosis that can cause acquired causes of epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So, if the patient having jerky movement, it will be clinically evident, and the family will also understand there is a jerky movement. Probably it will be seizure or epilepsy. But if patient having behavioral arrest and suddenly patient is moving one hand, putting inside the pocket, and suddenly one side he is not moving, this is called automatism, and patient will have behavioral arrest. He will not understand the things, and suddenly after 1 minute patient will become normal. So complex, the if such kind of symptom is patient is having, then possibility of temporal lobe epilepsy is very high.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
From ancient era, the majority of people think about this is related with the spiritual things. Okay, so something has been attacked. So they are consulting Baba and other people. So better not to go. It's a classical or clinically neurological condition which can be easily controlled by the treatment. Almost 70 to 80% of the epilepsy will be well controlled with the medication. Only 20% of the epilepsy will not significantly control with 2 to 3 agent, which is appropriately chosen. It's called drug resistant epilepsy. In this condition, we can choose the candidate for the epilepsy surgery if possible.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So trigger is like if a patient is sleep deprived, sleep if a patient having epilepsy, and if the sleep is not proper, the chances of seizure will be very high because seizure threshold will decrease. Simultaneously, the another thing like intoxication is completely restricted, and driving is not allowed for any seizure patient because they have a chances of seizure during driving. So as per government of India rule, you cannot become pilot or army personnel if you have epilepsy.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So the sleep should be proper, swimming is not allowed, and driving is not allowed. Rest other medication you have to continue as per your neurologist guideline. And apart from that, the family, if the child is mentally retarded, the family should give the tablet.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Exactly, exactly. This is very good question for the public of nation. If somebody is having seizure in front of you, kindly turn the patient in the left lateral position and make a video. Video is very important to, in fact, diagnose and localize the which kind of epilepsy patient is having. And if you don't put anything inside mouth like finger, spoon, don't close the nose because the asphyxia can occur, sudden choking can occur. Okay, so patient can die on these type of activity. So better not to do anything. Turn the patient in the left lateral position. remove all the sharp object from the surrounding and make a video. That is most important.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So epilepsy patient is just like us. They are not supposed to be neglected by the family. There are so many pregnant ladies are coming. Kindly take your medication, because nowadays there is no genetic or malformation noted with the newer agent of anti-epileptic drug, and they can continue the pregnancy. Don't miss the dose. Sleep should be proper, and don't do the driving and swimming. Thank you so much.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.